Only the wearer knows where the shoe pinches. The person who has suffered from vulvodynia knows how hard life can be. Vulvodynia means discomfort, burning sensation, or pain in the vulval area for over 3 months. These problems are often misdiagnosed as fungal or urinary infections. Women who have reached menopause may have misconception that vulvodynia is a postmenopausal side effect. However, none of these three conditions are vulvodynia. Women have suffered from vulvodynia for centuries, but science is yet to discover exactly why it happens or its definitive relief. If your doctor has diagnosed you with vulvodynia, you will find a wealth of useful information here. And yes, this is going to be rather detailed. The diagnosis of vulvodynia is not straightforward. In the absence of a rigid diagnosis, many women can become very confused by the symptoms. Yet, a lot of women suffer from vulvodynia for many years. For a doctor, diagnosing vulvodynia is not an easy task because research on vulvodynia has only recently begun. Even 40 years ago, there was not much research on vulvodynia, and even doctors didn't know what was it and how to diagnose. Most medical textbooks did not detail this condition. Today, we are going to discuss the symptoms of vulvodynia, its history, why it happens, and what management options are. However, before we delve into these questions, we need to understand what the vulva is. The vulva is not vagina. In lay language, the vulva is the skin-covered area between the thighs. The canal that starts from vulva and goes towards the uterus is known as vagina. Many women are confused about which area is vagina and which area is vulva. Yet, treatment for vaginal problems and vulvar problems can be very different. If you tell a doctor that you have got burning sensation in the vagina, the treatment will be different from if you say that you have got discomfort in vulva. Hence, to avoid misdiagnosis, you need some basic anatomy knowledge. The famous Californian gynecologist Dr. Jennifer Gunter has written a comprehensive book on this confusion, The Vagina Bible, The Vulva and the Vagina, separating the myth from the medicine. It is also suspected that not only women, but also lawmakers and personnel in legal courts do not have clear knowledge about what the vulva and the vagina are. You can now easily estimate that a body part which triggers so much of confusion will trigger even more misunderstanding when doctors first started to define what vulvodynia is. The name vulvodynia is rather recent. Science has struggled for many centuries before finding this name. What is vulvodynia? To reach a consensus among international scientists, a conference on the terminology and classification of persistent vulval pain and vulvodynia was held in 2015. From this conference, we know that if a woman suffers from vulval discomfort, burning sensation or pain over 3 months without an obvious cause, she is said to suffer from vulvodynia. How many suffer from vulvodynia? It is estimated that 1 out of 10 women suffers from vulvodynia. It is also suspected that this number could just be the tip of the iceberg. Many women suffer from vulvodynia, but due to social taboos, cannot discuss or talk about it in public. Many even think it is a fungal infection or believe it is related to menopause and must be their fate. Research by Bernard Harlow revealed that in the USA, 16 out of 100 women suffer from vulvodynia. So it is not uncommon at all. Most of symptoms involve pain in the vulvar area. However, the majority of these women do not visit a doctor. The problem often manifests when a woman starts using tampon or sanitary tampon first in their life. The research also reveals that half of the sufferers never go to doctor. Amongst those who went, many were misdiagnosed due to confusion about the condition. Vulvodynia could not be diagnosed even in the clinic in those cases. The uncertain, vague discomfort, sharp pain, dull pain, or burning sensation in the vulva could also be vulvodynia. Unfortunately, whenever they visit a gynecologist, they are often diagnosed with fungal infection and start antifungal treatment because fungal infections are very common in women. This leads to confusion about whether it is really vulvodynia or something else. When they shift from one doctor to another, women get frustrated and believe it must be due to their age and their destiny is to suffer. Scientific progress hindered by lack of disease name. Today, we have an international consensus on the definition of vulvodynia. However, the path to this consensus was never smooth. Over many centuries and decades, scientists could not determine the exact name for this condition, which is now named as vulvodynia. In 1976, at the Third International Society for the Study of Vulvovaginal Disease World Congress in Mexico, vulvodynia was known as burning vulva. In 1978, Dawson and Frederick first reported that unbeknownst to science, a whooping number of women complained of pain or discomfort in the vulva during sexual activities. It is not always a burning sensation. However, despite extensive research at that time, the cause could not be found, as science could not understand the reality of vulvodynia. It was given the name psychosomatic vulvovaginitis, suggesting that nerve issues might be behind causing this problem. After that, the condition had many different names, many of which were so complex that they were difficult to remember and pronounce, both for doctors and for the patients. In 1987, Frederick referred to a group of symptoms as vulvar vestibulitis syndrome. Later, scientists divided these symptoms into two conditions, vestibulitis and dysesthetic vulvodynia, complicated names. Finding a treatment for vulvodynia was more challenging because doctors and scientists were confused for decades, unable to even agree on a proper name for this condition. Eventually, in 1990, the International Society for the Study of Vulvovaginal Diseases, or ISSVD as known commonly, commissioned two internationally renowned scientists, Micheline Moyle-Baranco and Peter Lynch, to give a proper name to the condition. They decided that enough was enough and that a proper name is needed now. After extensive study and research, they came up with the name for this condition, vulvodynia. Further international debates in 2015 in New York led to a unanimous decision to name the condition as vulvodynia. Fine. Taxonomy, or the naming of medical condition, is an elaborate science. Until a condition has a proper name, research cannot progress. Now that the name is finalized, it is expected that there will be a lot of high-quality researches on vulvodynia, and hopefully, women will find solutions for this century-old problem. Cause of vulvodynia. At the same 2015 New York meeting, important insights were gained into why vulvodynia occurs. The reason is not fungal infection or menopause or urinary infection. The definitive cause of vulvodynia is still unknown. However, it is believed that it could be related to irritable bowel syndrome, genetic issues, hormonal imbalance, or certain hormonal medications. Also, if someone has a very high tone in their lower abdominal muscle or certain neurological conditions, women can start to suffer from vulval pain or vulvodynia. One must also consider other issues like anxiety, mood, or depression-related problems. Significant life events such as divorce, death in the family, sexual dysfunction, or marital disharmony may also trigger vulvodynia. Types of vulvodynia. There are numerous types of vulvodynia. Sometimes it can affect part of the vulva, and other times it affects whole of the vulva. It can start with certain stressors or constipation known as provoked vulvodynia. Other times, vulvodynia can come and go on its own, known as spontaneous vulvodynia. Oftentimes, it is triggered by identifiable factors such as wearing napkins or touch of a sexual partner, and sometimes it occurs without any triggers. Duration of suffering can vary too. Vulvodynia can last for days or weeks, or if it is continuous for more than 3 months, it is known as persistent vulvodynia. However, it can also be a constant condition that goes over many years. Occasionally, women may experience intermittent vulvodynia where the pain comes and goes on its own. This condition can be unpredictable, making treatment challenging even for well-informed doctors and patients. Treatment. A major part of the treatment is diagnosis. Unfortunately, reaching a diagnosis can take weeks or even years. There is no blood test that can diagnose vulvodynia. The first step in the treatment is to understand and accept that the patient has vulvodynia. After that starts special vulval care. This includes using only cotton undergarments, which should be changed regularly, and using 100% cotton menstrual pads or tampons. Avoid vulval soap shampoo, or vaginal wash, and avoid swimming in chlorinated pools. Swimming can continue in non-chlorinated pools. It is important to keep the vulva clean and dry, but remember that vulval skin can be very sensitive. Therefore, rubbing soap or harsh chemicals can be problematic in the long term. Only use ointments prescribed by your doctor. Sometimes, local anesthetic may be needed to blunt the pain or burning sensations temporarily. Women may also need to use estrogen hormone creams, but long-term use without a doctor's prescription can increase risk of cancer of the uterus, ovaries, and breasts. Researchers also suggest that when our body and mind do not work in unity, vulvodynia may start. Since the mind involves nerves, it can also be called a neurobiological disease, therefore. Hence, to treat vulvodynia, one must not only use traditional medicines, but sometimes nerve medications as well. Acute or chronic stress can make us quite unsettled, and a stress-prone environment may also trigger vulvodynia. As a result, apart from tablets and ointments, we must place adequate importance on meditation, relaxation, and mindfulness techniques. These can have calming effect on mind. Sometimes doctors prescribe tricyclic antidepressants or medications to block nerve sensations. Occasionally, anticonvulsant medications may be given to stop vulval nerves from firing unnecessarily and haphazardly. Additionally, mood medications like SSRIs can also be useful to some patients. Remember, whatever type of medications you take, it will always come with side effects. Therefore, you must not rely solely on pharmaceutical medicines such as tablets or ointments. It is important to understand why this problem happens and that no matter what medicine is taken, the problem may keep recurring. However, it can be controlled. To keep your mind away from the vulval suffering, you should do regular exercise, engage in hobbies, and use a comfortable cushioned chair. As I said, vulvodynia is a chronic condition that waxes and wanes. It is unlikely for vulvodynia to completely go away. Vulvodynia does not kill anyone, but it can seriously interfere with the quality of life. Sometimes mood problems can cause suffering, and the opposite is true. Suffering from vulvodynia may cause long-term mood problems. Women with vulvodynia can become psychologically very upset and frustrated, thinking that there is no easy way out. However, do not lose hope. Read about it, know about it, and share your thoughts. Go to your doctor to discuss once more what can help you. The treatment that you need may change every day. Today, you may need something. Tomorrow, you may need a different treatment. But at least you have found some relief. With treatment and lifestyle management, even if vulvodynia does not disappear or get cured forever, women can have a near normal lifestyle and enjoy life as usual. Take care and all the best for your management of vulvodynia.